So, hey, everybody, we're back on the couch for another episode, Life in Abundance podcast on the couch. I'm Stephanie Baker, and I'm the executive director, along with being a clinical pastoral counselor on staff at Life in Abundance. We are a counseling nonprofit located here in the upstate. We offer counseling to men, women, and kids. And we believe that when we strengthen families, we strengthen the community. And that would be the reason for our existence. In this podcast we wanted to focus on three areas. We wanted to bring you information on counseling topics. Sometimes information seems kind of mysterious, and there is a negative connotation for a lot of people when it comes to going to counseling. And we want to sort of remove that from it and take away some of the mystery about what is it like to go to counseling, what's it like to face certain things in counseling. And because of that, I interview not only people on my team, my counselors on my team, but I'm also interviewing professional counselors in the area. We have such a great referral network here at Life in Abundance. It's one of the things that I'm very grateful for, because if we're not the right fit, and sometimes we're not, we want to be able to connect people together, put you with someone that we know can help. So that's one aspect of the podcast. The other would be interesting topics in functional medicine and nutrition, because we do believe that we are triune beings, body, soul, and spirit. And so when one of those areas is not working, the other two are tweaked as well. And so we want to take a look at some of the more common things that are of interest to clients. When someone walks into my office and they're telling me that they feel depressed and they have low energy, honestly, it could be something as simple as a low vitamin D level. And so we look at the whole person. Again, with that topic, we also look at other ministries and highlight other ministries in the area, because there may be ministries that have something to offer that you're unaware of, and you may need a resource that they have. So those are the three areas that we look at. And today, I am excited to have with us counselor John Nolette. He is working with Restoring Hope Counseling, located in Anderson. And John has his master's from Liberty University in professional counseling. He has spent the greater part of 10 plus years of his career has been spent working with children, adolescents, and families. He specializes in working with individuals who have ADHD, autism, anxiety, depression, difficulties in school, those types of things. And we're going to hear more from him on that. So, John, welcome. We're so glad to have you with us today.
Thanks for having me, Stephanie. It's a pleasure to be here.
Well, it's awesome to have you. So as we go into this topic, one of the things when you and I were talking the last time we spoke that really struck me was your passion for working with youth who are struggling with autism or ADHD. And I thought maybe we might just start, and we'll see where the Lord takes us, but I thought we might just start talking about ADHD. Now, when I was coming along, and I'm 60, this year. Still getting over the trauma of that. Maybe I need to schedule with you for that. But
We can schedule
so
something and talk through that.
so so when I was coming along, it wasn't diagnosed. There was no diagnosis really of ADHD. My husband the same way, and he actually does later in life. He was diagnosed with that, but he was the kid flipping his chair over backwards in his classroom to get people to laugh, and had a hard time kind of sitting still in class. That's typically how I think a lot of people think about ADHD, but I think we would be really well served to sort of define what that is. And if so, maybe even we've heard the term ADD. Can you help us define differences in what that looks like and how it's diagnosed?
Yeah, so I think ADD is primarily the diagnosis most people are familiar with. It's what's come up all these years. In the last 10 years or so, it's really transitioned from just being a diagnosis about attention deficit. So having the lack of focus and really difficulty concentrating or maintaining attention on tasks or even completing tasks, which is primarily what you see in ADD, compared to kind of this newer diagnosis that's come along in the Diagnostic Statistic Manual 5, which would be the attention deficit hyperactivity disorder, which
Okay.
really adds in that there's several elements. So ADHD can really be defined in kind of three capacities, even within the DSM-5. You have the focus on the primary, it's predominantly inattentive type. So that's where you'd see more of your traditional ADD types of diagnoses, where you're going to see kids who struggle with focus. You're going to see people who have a lack of attention, missing little details, and things like that, skipping over things, easily forgetting things, losing things. And then there's predominantly hyperactive type, which is going to be where you're going to see individuals and children who are kind of like they're driven by a motor. They never stop. They just keep going. They can blurt out. This is those kids who just can't control themselves and just blurt out the answer in class, or are finishing other people's sentences. These are often the kids too that you'll see just seem to get like the reputation for having just a lot of behavior problems. That
Mm,
really it's just kind of that motor is constantly going and they can't slow that down. So they have
okay.
difficulty kind of neurologically slowing down the process and taking steps that they need to in that capacity. And then there's the combined type where you'll see kind of a combination of both of those. So they have inattentive problems, but on top of that, they have that hyperactivity along with that.
Okay. So when you are working with a family, like typically what outside of somebody watching this podcast and going, "Hey, we need to schedule with them," how do kids typically end up coming to you? How do families end up deciding they need counseling for their child?
Yeah, so I mean, you can self-refer. So if you are starting to see things in your child that are kind of concerned behaviors, you can contact our office or other counseling offices to kind of reach out and set up an appointment to have like an intake, which would be just kind of again an interview process to go through what are things we're seeing, what's happening, kind of do some observations of behaviors in those sessions. People will also go through their pediatrician or a doctor oftentimes, where they will complete a screening assessment, usually, which would be completed by your primary caregiver. So both mom and dad, or like if there's a grandparent or an aunt and uncle, someone who watches the kid quite often, they'd have those individuals complete that assessment, and then they'd have a teacher complete that assessment. So whoever the primary teacher is for the child, because again, with ADHD, you want to see it impacting the child in multiple environments. So it really is causing distress and concern in multiple environments for the child, and that's why you'd have kind of that overview of those assessments. They can also have some behavioral assessments done, which can be done through school as well. So two of the more popular ones would be the Connors or the Basque 3. And those
Okay.
kind of look at overview of not only their behavioral functioning, but also kind of how they're doing in some life skills as well. And so it focuses way beyond just academics and their achievement in academics, but what are they doing? What are we seeing and observing them in terms of their behaviors while they're engaged in something that would require attention and focus, and then being able to kind of sit and rest.
So, if you don't mind me asking just a couple of questions about that, a little more in detail. So, these evaluations, do they involve then multiple people observing the child from multiple different perspectives?
No, it would be gathering data or information from those people in terms of when they're filling it out. It's going to ask questions
Okay.
like, do you see this in your child? Do they struggle with maintaining focus? Do they constantly get up and move around? Do they fidget? Do they lose things? So it's going to ask some of those types of questions where you're kind of able to gather some data points and
Okay.
information. And then for me, in terms of the counseling process, in my first several sessions, I'm going to do a lot of observations of the behavior. I'm going to do some games or some play or something fun to kind of engage a child to see if I can sustain the attention of that child in an activity.
Okay.
Because in that, it's helping to kind of be able to observe and see what's going on as well, even as they're in the room. And it takes a few sessions, especially for children, to kind of get comfortable. So oftentimes I see kids who come in and are very nervous. Their behavior is a little different than what parents would usually describe, but a couple sessions in, or even 4 or 5 sessions in, you usually start seeing them be a little bit more comfortable and engage differently in the process.
Gotcha. So, all right. So, at what stage do you typically see the client? Like, what's gone on that's brought them to you?
Yeah. Well, typically that would mean if they're coming to me for counseling and it's not like a proactive step by parents, because there's family history of ADHD or there's previous diagnoses, it's probably because there's some behavior concerns. So whether that's they're having tantrums, outbursts, they're having difficulty managing emotions, or it could be even that we start seeing behavior in school or grades start to decline. which can
Gotcha.
often be a factor for kids with ADD or ADHD, where you'll see them start having trouble in school and it becomes a little bit more difficult in terms of managing behaviors and their emotions.
Okay, okay. When you start working with a young person who has this diagnosis, right? You're working with the person. You're not just working with the diagnosis, you're working with the person. And I'm guessing because everybody is so different, it can look different in every single kid that you work with. How do you determine steps to help that particular kid? Like,
Yeah, that's a good question, Stephanie. I think part of that becomes it is an individual diagnosis for that child, and so where there's going to be deficits or gaps for them is going to be different than anybody else. It might look similar, but what's going to help them is really kind of building that treatment plan and individual goals for that child to really learn how to start managing some of those symptoms.
okay,
ADHD to me is not one of those diagnoses that you cure or fix, and so it's something we really learn how to manage the symptoms of ADHD because those things don't go away even after you've been through counseling or take medication.
right.
But you have to start learning how to manage those things in your life and how it's impacting you in kind of negative ways.
Right. So, how often do you, or do you at all, end up meeting with just the parents after you've been working with the kid? I'm guessing that's part of the treatment plan overall.
Yeah, I do a lot of work. I will tell if I'm seeing children under the age of 10, I want parents in my sessions. I don't want to just work with a 10-year-old or under, and expect them to remember the things we're working on and then apply those on their own. I really
Mhm.
want to do some parent coaching, some parent training, modeling, and get the parents involved in sessions when we're doing some of our activities and things. Because I want the parents to feel empowered, but also to have questions and to be able to engage in that process where they start seeing what it looks like, and even what the changes are when they start implementing some of the strategies and interventions that we're working through in our sessions with their child to help manage some of those symptoms.
Okay.
And so I always include parents. It's a little different approach for me than some of my colleagues and some other people that I've worked with. But for me, the importance of that is to really empower and coach the parents through some of that.
So, how many, and you might be able to answer this and you might not, but how many parents would you say that you work with these kids who have the diagnosis? How many parents actually out of those families have ADHD?
I would say it's probably greater than 50%.
Wow. Okay.
It's hard to put an exact number on it, but like you said, I think it was not something diagnosed. It almost took a shift somewhere in like the probably the 90s, early 2000s, where it went from not
Yeah.
being diagnosed, and so you have a bunch of adults getting diagnosed at an older age, to now it's one of those ones that we consider it's probably overdiagnosed in children because of, oftentimes we look at it too, it's a lack of executive functioning for children, which when we think about executive functioning and the prefrontal cortex and the temporal lobes, like those don't get developed until you're early mid 20s, even late 20s for some people. So again, they lack some of those skills and awareness and what's going on in those capacities already. But then you think you just see with technology and how we live life now, I think it becomes more prevalent because we see so many people that there's so many distractions and things that are vying for our attention that it's very easy to see kind of ADHD popping up for a lot more individuals.
Yeah, that I've seen some statistics on too. So can you give us some ideas of things that you actually might coach families on
Yeah.
with their kids?
So one of the biggest things I work on is I want parents to break down tasks. So the best things, one of the easiest examples I can give you is like when we talk about, hey, when you first get up in the morning, as a parent, you might be like, okay, we got to get ready. We got to get out the door, right? And so you're telling your child, okay, you got to eat breakfast. You got to pack your lunch. You got to pack your bag. You got to get dressed. You got to get your shoes on. Oh, don't forget to brush your teeth, right? And so somewhere in all that, you've just given your child like 6 or 7 steps to try to remember
Right.
without any further reminders or kind of going through that and really breaking it down easier for them. And so slowing that down and really looking at how do we break down steps. So
Okay.
I do that in a lot of ways. I'll do that through some games, through some activities. Puzzles is a great way to do that for me because I get them and the parents to be like, okay, how would you complete a puzzle? Because most people don't think about that. They just start engaging and putting a puzzle together. And so when you break down, okay, well, where do we need to start? How do we need to start with this? Right.
That's a
And then,
great
and then
analogy.
what's the next step that we're going to take from there? And how do we get to where we see it as a completed task? Right. Because I
Right.
think with kids with ADHD, oftentimes they can start something, but then there's a whole bunch of other things that kind of come in between that of they get overwhelmed, something else distracts them, and they never finish things. And so it can be the same thing with parents. And so to me, something like that, breaking those steps down for them is really crucial in helping them kind of learn to do that. So we do that with behaviors too and emotions. So we'll talk about creating token systems in your home, reward systems where we are getting creative with how do we gauge them in doing the things they already know how to do and keeping it simple. And then how do we add a new skill? So how do we get them to start working on something new that they can be doing at the same time as they're already mastering a couple skills that they know how
Okay.
to do well. And so those are some other ways to do that. Time management becomes a big one.
Mm,
And then emotional regulation. So oftentimes teaching kids emotional vocabulary, but also engaging with them that it's okay to experience that and exploring where it's coming from, why they're feeling that way, what's happening that kind of puts them in those situations. And so I formally use cognitive behavior therapy in my work with kids and adults with ADHD. And so in that part of the process is kind of restructuring like the thoughts and those feelings that they're having and kind of putting them in the right place. And then kind of where do they go from that? How do they kind of come from that and kind of create a new way to think or look at a situation?
that's excellent. Let's go back to the emotional regulation.
Mhm.
What happens in working with the parents when you have parents that aren't able to regulate their emotions?
Yeah. So when I do talk about emotional regulation in my sessions with parents and children, I think parents get just as much out of that as the kids do, right? They go, oh, yeah, like I don't think I do that very well. Or,
Mm,
oh, yeah, I see how she responds in the way I'm reacting or responding. And so some of it really comes down to like parent the child you have, right? Like don't parent with the expectations that your child's going to be different or is going to mature and grow out of some of these things, but parent the child that's right in front of you. And so in that, you're dealing with not only where are you coming from and dealing, how are you dealing with things emotionally, but I think how is your child observing those things and interacting with you emotionally in that level. So if you're yelling, right, like one of the best examples here is power struggles. Power struggles being child doesn't want to do something, goes into that no, I'm not going to do it phase. Parents go, you're going to do it because I told you you need to do it, right? And now we're in the midst of this conflict or power struggle where parents are trying to exert their will over their child, and their child's trying to exert their will of what they don't want to do in the moment, right? And so I think when you can kind of step back and away from that a little bit and you can explore that of why they don't want to do that, what's happening right now, how am I responding and reacting in this moment? I think it helps parents be able to recognize what their child's actually experiencing and kind of call it out. Because children also will oftentimes express through behaviors what they're feeling. So they're
all
not
right.
going
Can you give us an example of that?
to, so like when a child's mad, they're not going to sit there and tell you I'm mad. They might just start yelling and screaming.
Okay.
Or they might come up and just wind up and hit someone, right?
Yeah.
So that behavior speaks volumes and is a language all of its own that you can tell if you're paying attention to that and aware of that, you can tell that something is going on. They're probably upset or mad about something. And if they go and hit someone, well, you can tell even who they're mad at, right? So you
Right.
can start piecing together some of that where they're not going to necessarily tell you, I'm upset or mad about this, right? And the goal is in that even through the behavior work and behavior modification stuff that we work on is instead of just coming out and hitting a child or instead of having that big outburst that oftentimes parents see, we want
Mhm.
to be able to kind of work through that and get them to see healthier ways and more effective ways to get needs met. Because I think when we look at emotions, it's either we're having emotions that help us see that our needs are met, or they're emotions that we don't see our needs being met. And so it's not that they're good or bad or they're right or wrong, but it's does it help us meet a need or is it working against that and not helping us in that moment?
That's excellent. Um, So I guess I'm curious about something else too. How many parents blame themselves that this their child that they love is struggling from something, and now, as we're listening to you talk about this, it's something that you don't just take an antibiotic and it's gone. Like, this is going to be something that they're going to deal with, for lack of a better phrase, or learn how to manage for their lives. What do you say to the parents that blame themselves?
I think normalizing that and just creating a space for them to like, so I will meet with parents individually as well, just
Hmm.
having parent sessions, and giving them an opportunity to voice those things, right? Because I think they do. That shame language, that guilt comes on
Yeah.
very strong and hard for those parents of it's all my fault, my kid's going to struggle. And it prevents them from really doing some of the work that they need to continue to explore and be curious about how do I help my child. Because I think, again, in that, if we're stuck in that shame language, then we look at all those things as problems instead of looking at what's a solution.
Hmm. Hmm.
So this is going to hinder my child. They're never going to do well in school. That's not true. People with ADHD go on to have very successful careers and can, with help, academically and achievement wise, do very well in education.
What gives you a positive outlook on it, as you're working with all of these kids, because this really is not just a small minority. This is growing, actually, this diagnosis. So what gives you hope in the midst of that, as a counselor who sees all of this?
Yeah, so recent statistics, Stephanie, say that 6.5 million children in the US have ADHD diagnosis.
Wow.
So that's about 10.5% of the population. So it is kind of growing. I think what gives me hope is the fact that if you look at how to take some steps and be intentional about addressing some of the needs and really helping your child learn to manage that, you can see very positive outcomes, right? So treatment for ADHD often can involve some coaching. It can involve being in counseling. It can involve medication sometimes for individuals.
Okay.
It also involves what I think is a growing area in counseling is really the practice of mindfulness.
Yes.
So being able to be present in the moment and engaged
Mhm.
in the present moment instead of distracted and worried about everything else that's going on. And I think in the day and age we live in, with all technology and everything else that happens, especially for kids, to be able to stop and be aware of just what's happening in the moment is very powerful for them. And so I
Yes.
do I do a lot of work with parents and the child to really work on some of that mindfulness approach, um, and incorporate some skills for them to really be able to learn how to do that. Because again, that aspect really helps them engage in what's happening right now.
I love that. And I mean, I'm working with adults that we're talking about how to ground themselves. And I mean, literally, physically go put your feet in the dirt and
Mm-hmm.
touch the earth for 15 minutes at least a day,
Yeah.
or buy a grounding mat and do it. But put down the digital technology, which leads me to my next question. Is there a correlation between gaming and cell phone and TV, all of the electronic connection? Is there a correlation there that would show that it actually makes ADHD symptoms worse, or struggles worse?
I think that's still something being researched, and I don't think there's been enough research done on that topic. I think, yes, it's easy to blame technology for kids having ADHD and things like that because they are so distracted, and TV, iPads, iPhones, gaming, are all things at their fingertips, and it's so easy to engage in technology nowadays. And it's even happening in schools with Chromebooks and how they're incorporating
Yes.
technology in schools. That I think it's easy to see that there is a I think it's a factor in ADHD for some individuals. I don't think it's the only thing that would
Right.
cause ADHD. I do think you have to look at that as a potential factor to ADHD, though. And the growing research kind of indicates that with more technology use, we are becoming more and more distracted, and
Hmm.
and even though we have more access to people, we are pulling away from being in close community and
Yes.
relationships with people. which I
Well,
think
and
does impact ADHD.
yeah, I can definitely see that. And I'm talking with clients on a regular basis about how much screen time do you have. I have a college student that was telling me her screen time per day was over 6 hours.
Yeah.
And that is going to impact your sleep also. So, but I it's going to metabolize as adrenaline. And so I guess I'm wondering like how what is and you've answered it, like there's not a specific link, but it sort of fans the flames that are already burning.
Yeah, and I mean, when you really think about some of the things that impact neurologically the functioning for ADD or
Hmm.
ADHD, you're talking about dopamine, you're talking about
Hmm.
serotonin, you're talking about some of those pleasure hormones and how that's released in the body. You're also talking about sometimes there's misconnections in the brain chemistry for people with ADHD. And so I think sometimes the better way to look at ADHD is almost like preferred activities versus non-preferred activities. So
Oh, I like that.
you will have some kids who can really focus on, video games and things like that. And you're like, well, how could they have ADHD? Because they can spend 4 hours playing video games. Well, that's a preferred activity for them. So they can
Right.
get lost in that world of fantasy, no
Hmm.
problem, and be totally attentive. They can get lost in a show or
Hmm.
different things like that. Um, while other kids, that might be sports or it might be books or it might be other things like that. And so you've got to look at some of what are your preferred versus non-preferred activities. And then I think even some of that is everything's so quick. So social media really makes everything
Yes.
so quick where we all are just looking for that instant gratification and we don't really have practice delayed gratification a lot in our culture today. And so we don't wait for pretty much anything, right?
Right.
So that also I think feeds into some of those symptoms of ADHD very easily, where we see that just in large in culture in the society, people struggling with some of those symptoms.
Yeah. Um, I was laughing because when I ate fast food, I could be the impatient one in the fast food line. Like it's not moving fast enough. So yes, very much so with what you're talking about there. At what age is there a general age that this is typically diagnosed? Or, I mean, is there an average age where it starts showing?
I think the average kind of age and where you probably see the most diagnoses is probably elementary. So
Okay.
whether that be early elementary or kind of like late elementary, those are probably your most common diagnosed years for students and
Okay.
children. Because again, they're in multiple environments. So you're really seeing them for the first time. They're in an educational setting with a structure and routine, and you're able to
Mhm.
start seeing achievement scores and grades. Um, they're probably more involved in activities outside of the home and school. Before that, it can be diagnosed at about 4 or 5. It gets a little bit more
Wow.
difficult because you are also talking about developmental stages and what's going
Right.
on with those children. And let's be honest, like the saying forever in the 90s was like, well, every boy could be diagnosed with ADHD because they're all hyperactive, right? um, which to some extent there's some truth to, right? And so you almost got to think of it like an iceberg. What are the contributing factors underneath what you're seeing just as the symptoms?
Right.
And
Right.
so what's kind of causing that? What's influencing that? What's happening other parts of this child's life? But I think the most common is that elementary age.
Okay. Okay. Is it uncommon for adults to be diagnosed with it? Like it just was missed. Um, as we said, well, in my era, it was not diagnosed, but it's not something that would be adult onset. It would have been there the whole
Yeah,
time,
it
correct?
probably would have been there the whole time. They might have been really good at hiding it or masking it. It's almost like or people just ignored it, right?
Right.
It wasn't brought up. One of those things can be. I've worked with parents who have come in and said, "Well, my parents homeschooled me because the public school said I had all these problems and they couldn't deal with me, so my parents took me out of the public schools and homeschooled me," which is fine. But again, some of those people are now as adults are starting to
Right.
realize some of those symptoms and behaviors were because of ADHD stuff, and
Right.
they didn't necessarily get some of the help and some of the things that they needed as a child, so they're getting diagnosed later on in life. The statistics for 2024 or 2023 released were 15.5 million adults are diagnosed with
Wow.
ADHD. So 6% of the population of adults in the US
Wow.
are also diagnosed. And that is adults being diagnosed, not adults who had it through childhood. But
Right.
Oftentimes, I think there are symptoms when you talk with adults who have been diagnosed with ADHD. They come in and are like, "Oh, that makes sense. You know, when I was a child, I used to struggle with this. I used to have problems with this," or parents do it for them, right? And so, oftentimes, well-intentioned parents, right, trying to help their kid do more than they should for their child. Because I think we forget too, as human beings, we need kind of three things. We need autonomy, so we need to have that independence. We need to belong, we need to have connection, so we need to have community. And then we need competency, which is like knowing that we have skills, right?
Right.
And so
Right.
I think we take away that, and I think a lot of adults who get diagnosed with this, it's later on in life they see some of the problems coming out for them, and when you talk to them, for me, oftentimes it's parents were overly involved with taking care of things for their child, or they ignored things that were very clear symptoms of some of those things,
Mhm.
or the kids just got really good at masking some of those things, right? Um, or they turn to other things to really kind of help. You hear a lot of adults who come in for counseling, and they'll talk about how throughout high school or college they smoked weed or they did some other substance because it helped them. They felt like their brain stopped when they used that.
Right.
And
They kind of
so
calmed.
it calmed them down the same way that the medication would have an impact for children and adolescents. And so some of that can be kind of clear tell signs that it was always there. They just ignored it or kind of dealt with it as they could. And so it can be a little bit more eye opening for adults, I think, in terms of like the struggles they had through childhood and adolescence and even into adulthood. And then for them kind of coming up with, again, strategies, interventions, structure, and routine for them to kind of operate with them.
Love that. When you're working with a family who is experiencing this and they've come to you, is there an average amount of time that you work with a family, or is it? I realize every family is unique, but is there an average amount of time? So if I'm a family right now thinking, "Gosh, we really need to talk to John about this," but I'm also wanting to like think to myself, "Am I going to have to take out a loan, right, to afford all this? How long is this going to go on?" Like, what would you say?
Um, I'd say typically it's about 6 months.
Okay.
And again, that varies based on what the severity of the needs are.
Right.
So I don't always say in my practice that I have to meet with you weekly to do
Okay.
effective counseling. Now there are instances where it's severe and we're seeing a lot of symptoms and behaviors.
Mhm.
So it's helpful to start out weekly to build rapport and to really get going in some of the work and to really be able to kind of observe and kind of pick up on what are some of the struggles we're dealing with this child or this individual that's in front of me and in the counseling room with me. But at some point, I might even scale that back to where we meet bi-weekly, or we may get to a point where we start meeting monthly. But um, traditionally, I see more of like it's probably about 6 months to a year, really, to go through what you need to. Because again, there's so many facets and so many components of
Right.
where are the deficits, where are the areas where we need to see have like a growth mindset of how are we continuing to develop these things. And for me, with my approach with the parenting, that adds additional sessions, but also engaging them in having the confidence to kind of deal with this. And so
Yeah.
for me, once parents feel like they have a grasp of it and they really are understanding it, and then once we've seen some of the behavior changes and things we're looking for in the child, I really look at kind of stepping back at that point, or like we'll scale down to bi-weekly, monthly, because I still want to continue in making sure that they feel support and knowing that hey, there's still going to be some things that come up. Some
Yep.
of them are very normal, so we
Yep.
normalize a lot in counseling, but I think also validating the fact that yeah, it's a struggle still. There's still
Yeah.
some things that come up, and I'm still dealing with X, Y, and Z, and just kind of
Right.
refreshing and resetting. Hey, remember what we talked about with this, right?
Yeah. Well, that makes perfect sense because if you're starting out with somebody who is even in junior high, it's going to be a different set of circumstances in high school.
Mhm.
So that makes perfect sense. And what I love about that is that they already will have hopefully an established relationship with you that they
Mhm.
feel comfortable with. And so it's not like starting all over again with somebody completely different, that, they have to do all of the re bonding and that kind of stuff. So that's great. That's great. Quick question. You
Mhm.
mentioned medication. What
Mhm.
is the most common medication that is now prescribed for ADHD?
So typically it's methylphenidate. So
Okay.
typically the big ones we know are Ritalin, Adderall. There's several other ones that kind of fit in that category. Focalins in that category. Vyvanse is also in that category. Um, and I see a growing number of people who are kind of hesitant to medication. So
Hmm.
where it used to be, you just went to your doctor, blindly trusted the doctor said, "Hey, take this
Hmm.
medicine; it's going to help." I think there's a lot more people who have questions, and so I also give parents a little handout of here's questions to ask your doctor if you're considering medication,
That's
and
great.
make sure your doctor actually knows the symptoms and managing of this diagnosis. Because if they don't,
Yes.
then that can become problematic. Because medication, if you have severe symptoms of ADHD, medication can impact it very quickly in terms of being able to make some changes, but it can
Mhm.
take up to about 6 months to really see a consistency in
Wow.
that. And playing with the medications to get on the right dosages or the right medicine, because there's a lot of side effects from medications, especially when we're talking about those stimulant medications.
Right.
You see kids struggle with sleep. You see kids struggle with appetite stuff. You see
Hmm.
kids have changes in their mood because of that. So some of those cause kids to become really irritable or just have like a low mood where they used to be like a really happy, energetic child. Um, and so those are some of the more common ones, but there also can be some other ones of like nausea and some headaches and different things like that. And so just monitoring that is very important. I don't always have my clients or parents go see a pediatrician or go to their pediatrician to ask about medication, but it's something we do talk about and we do discuss. And
Right.
we'll with parents we'll kind of work through what are your hesitations.
Hmm.
What causes you to have some reservations about putting your child on medication. And me personally, my experience working with kids from all different kinds of backgrounds, um, I've seen it very effective for some kids, and I've seen other kids who end up getting put on medications that causes no change, and they just get added more medications to try to manage and control symptoms and
Right.
behaviors instead of actually working through some of that
Yeah.
and kind of engaged in a different process. And so
Yeah.
there's a lot of natural things that people are also doing. So, Attitude Magazine has a lot of good resources for parents and articles that they put out about
Okay.
natural supplements, diet, and exercise changes for parents to consider. Movement being a crucial one, sleep,
Hmm.
you talked
Yeah.
about. We don't function
Sleep
well when we don't get
hygiene.
enough sleep. Um,
Right.
so, they have information about sleep hygiene. And then, just in general, some other things that oftentimes our bodies seem to lack in terms of being able to naturally produce that can benefit sometimes in terms of managing some of those
Okay, that makes a lot of sense. John, thank you so much. I know you have a very busy schedule, but I just want to thank you so much. This is such an important topic, and I have several clients whose kids are dealing with this and their families are trying to deal with it. And, there are siblings that don't have it, and that's yet another component of it. One of the things I would like to do in the future, if you're up for it, I'd like us to do an episode on autism if you'd be willing to come back and talk to us a little bit about that.
things. Yeah, sure.
Awesome. All right. Well, thank you so much. I greatly appreciate you taking your time to be with us, and we look forward to having you back on.
All right. Thanks, Stephanie.